Okay, good afternoon, everyone, and welcome to part 2 of the poster panel for the Division of Academic and Scientific Affairs, New Jersey Psychological Association. My name is Dr. Fran Conway, and I'll be your moderator for today. So welcome. As we go through our program or time together, please be encouraged to put comments in the chat if you would like to make a comment. We are under a very tight schedule, so I will ask that you please keep your remarks brief and as to the point as possible. So I want to say, first of all, that I'm so impressed with all of the submissions that came in this year for the poster presentation. This second poster hall, the symposium, brings a diversity of topics relevant to the intersection of psychological well-being and social factors. The discussions begin with considering the social factors, including matters relevant to the pandemic of racism, such as racial microaggression and clinical symptomatology, and to the COVID health pandemic, its impact on diverse psychology graduate students. Other societal factors include marijuana use, social media use in dating and its applications to relational styles, and psychological distress. As a matter of fact, 2 and 3 of our contributors examined mindfulness and as well as how to cope with psychological distress. So I would like to start by asking you to please say your name, the title of your poster, and your institution. I'll start with Natalie.
Hello, my name is Natalie Zychlinski. The project I am on is saying hi to marijuana legalization and its effects on United States crime rates. And I'm currently receiving my master's at Fairleigh Dickinson University in Teaneck, New Jersey.
Fantastic. Emily.
Hello, my name is Emily Klein. My project was on depression, anxiety, and the utilization of online mental health services among young adults. I am receiving my PhD at Montclair State University.
Okay, fantastic. And as you introduce yourselves, if any of your co-presenters are here, you can join in at that time. Okay, Emily Tully.
Hi, I'm Emily Tully. I'm on the same project as Natalie, the Saying Hi to Marijuana Legalization and its Impacts on United States crime rates, and I'm also from Fairleigh Dickinson University.
Hi, everybody. I'm another author on the same project, so Fairleigh Dickinson University. I'm Bennett Height. Yeah.
Thank you, Bennett. Dominique.
Hi, it's Dominique.
Dominique.
Yeah, my name is Dominique Reminick. I'm a third-year clinical and school psychology student at King University. So my poster is called Adverse COVID-19 Events Survey, a trauma-informed investigation into the disparate impacts of COVID-19 on diverse psychology graduate student populations. And we have 2 other presenters as well, one of which is here, Christina. I think she's still logging. Oh, there she is.
Hello, my name is Christina Crute, and I am actually a final student in my MA in psychology program and working on this project with Dominique as well. And yeah, that's it.
Thank you. Thank you, Christina. And I do apologize for the mispronunciation of your name, so please do correct me. Brad?
Hi, everyone. My name is Brad Ahern. I'm working on a research project entitled Relational Styles and Motivations for Those Who Use the Dating App called Bumble. I'm a third-year doctoral student at Felician University.
Thank you. Ritvik?
Hi, my name is Ritvik Dutta. I'm a second year in Kane PsyD in combined clinical and school psychology. My poster, well, not mine, but our poster was called Mindfulness as a Moderator of the Association Between Social Media Use and Depression, Anxiety, and Stress among college students. And my co-author is not here, Mo Seplowitz. And we did this with our faculty advisors, Dr. Block Lerner and Dr. Marks, who aren't here. So shout out to them.
Thank you. Christopher?
Hi, everyone. My name's Christopher Watkins. I'm a fourth-year student in the William Patterson Clinical Psychology Doctoral Program. And our poster is titled Exploring the Relationship Between Racial Microaggressions and Clinical Symptomatology in Ethnic Minority College Students. And my co-presenters are here. I think I saw Fernanda Mora, Kashani Pereira, and our faculty advisor, Dr. Aileen Torres. So if any of you guys want to jump on now and introduce yourself as well.
I'll say hi. I'm the faculty advisor, so I want them to introduce themselves.
Hi, can you guys hear me? I'm Kashani, and I am also a fourth-year PsyD student at William Patterson in the Clinical Psychology program.
Okay, Marcella? You're on mute.
Yes. Hi, everyone. My name is Marcella Farfan, and I am completing my PsyD degree at Felician University in Lodi, New Jersey. And my poster is titled Latinx Adaptation of the Philadelphia Mindfulness Scale.
Okay, fantastic. Thank you all for joining us and for the good work that you're doing. I'd like to start by and letting you know that many of my questions are related to your research. I'm not asking you to retell us what your study is about, because we've all seen the videos and you did such a very nice job of presenting. So thank you for doing that. Many of my questions today are focused on the implications, and in particular, locating your studies and the importance of it and the impact of it on COVID and the racial reckoning pandemic. So given these two pandemics, one focusing on COVID and the other on racial injustice, I'd like to start with Dominique and Christopher. Can you tell us one thing you have learned from your research that can help us as psychologists respond to individuals who are experiencing this crisis, whether it's the COVID crisis or the racial pandemic that's, racial reckoning that's happening across the US. So I'll start with Dominique.
Excellent. Yeah, thank you so much for the question. That's a fabulous question. I think it's really evolving still, at least for my work. So all of the data collection is done and we're still looking at our results. As you can see on the poster, those results weren't necessarily significant. We didn't have enough of a kind of a diverse population for our sample, but we have more people. So now we're going to analyze that. New directions I'm going in is really, or that we're going in is really looking at intersectionality with these pieces. So we often look at data and we'll look at, how the COVID-19 pandemic has really affected, Black people or women or people with disabilities, but we're not really looking at kind of we're seeing them as separate, discrete moderators, but we're not looking at the interactions of those. So I think I think we have enough of a sample size to really look into that and see if maybe this is really affecting people, disproportionately.
I'm going to limit your responses really because we have more posters than usual in this session. I'd like to get to everyone. Okay, all right, great. We'll be able to circle back and have more of a discussion later. Christopher?
Thank you. So I think the main takeaway from our research was just that there is a relationship between experiencing microaggressions and psychological symptomatology for ethnic minority students. And so from a clinical perspective, it'll be important to understand that relationship a little bit better and keep it in mind when treating members of these populations, understanding that even if not initially presented to treatment as a presenting problem, that racial microaggressions do have an impact on the psychology and the symptomatology of these students.
Thank you. Kashani, do you want to add anything to that?
Sure. One of the things that we saw was the the concept of feeling foreign or being at the foreign-based discrimination for Latinx and Asian populations. In our study, we only saw that for Asian students, and that's really important right now with the COVID pandemic, given that a lot of Asian individuals are at the receiving end of a lot of race-based discrimination.
Yes, and I want to congratulate you both and your advisor on winning the Best Poster Award. So congratulations on that. Okay, wonderful. Next, I'd like to speak to Emily. So you looked at marijuana use and its relationship to crime before and after legalization. And then Brad, you also looked at another stigmatizing, socializing factor, which is you know, the use of dating apps and sort of the stigma that comes with that. And I would argue that both marijuana use and dating have been impacted by COVID, I would say. What are your thoughts about these two social factors as it relates to the COVID pandemic?
I would like to start with me.
Sure.
Okay. Well, in terms of dating, I mean, the facts are that they're still on dating websites and still looking to find someone, even in a pandemic. So, I mean, that's kind of, you know, suggestive of people being isolated and still wanting relationships and things of that nature. As far as the stigma of the dating apps, I mean, there's a long history of the stigma of them looking for hookups. It's supposedly a hookup culture, but some of the results that I found are contrary to that in terms of you know, people are just really looking for relationships. And I think now more than ever that would be truthful.
Thank you.
So I think in terms of the pandemic and marijuana use, it has definitely gone up, and it's pretty difficult for people to cope right now. So with Murphy trying to legalize marijuana in the upcoming election and on the ballot, I think by legalizing marijuana, it could also help decrease crime. And like and the presenters before me, they were talking about racial injustice, and you definitely see a lot of that with marijuana arrests and possession charges, and even with the Rockefeller drug laws as well, which was talked about in the introduction of my poster.
Thank you so much. Appreciate that. Now, I'd like to address the last three studies, and which focus really on how people cope with their distress. So Marcella, you focus on adapting a mindfulness scale for use with Latinx populations. And Ritvik, you focused on how mindfulness can be used to moderate distress due to social media use, and I might add online dating. And then Emily discussed the need for online services to address to address increased mental health issues that are facing college students. So my question to the three poster presenters are, what connections do you see between your work and the current COVID or racial pandemic that we're dealing with at this point?
I can go first, if that's okay. Yes, I think that using mindfulness can really help people that are dealing with COVID stress at the moment. And when you work with a Hispanic population, it is important to have scales that are made for their language. So that's the reason why I decided to adapt the scale, even though it was translated in Spain. But when you adapt the scale, you not only look at the translation of the language, but you also look at all the cultural linguistic aspects from translated from one group to the other. So I think that right now, mindfulness is an important intervention that we can use with clients that either lost someone to COVID or experience anxiety because of it, or they need support in that area.
Great, thank you.
I'll speak on behalf of the poster that I had done with some colleagues too. We looked at mindfulness as a potential moderator in social media use, like quantity, like how much you use it relative to psychological distress. So depression, anxiety, and stress, it's it's a pretty popular scale, the Lovibond one, the DOS. And we didn't find that mindfulness did moderate, you know, the relationship between how much you use social media and how distressed you are. We used a college sample. We thought that we would, but I think it was important that we kind of understood that perhaps it's more useful to look at, rather than how much people are using social media, like what they're using, the quality, the function of it, relative to you know, having a mindful and accepting stance to that usage. And we do think that that is a question that is worth examining and considering. It's been found in past research that depressive symptoms too are sensitive to like the function of the social media use. So although our study didn't find anything significant in that realm, I think it does sort of lend itself to that question of like, all right, let's still look at you know, specific functions of of social media use, and if a mindful accepting stance can help people relate to that better. And the biggest implication of that is to do interventions to help people build those skills.
Okay.
So it's kind of cool.
Thank you, Ritvik. Actually, I wanted to know whether or not Bennett and or Natalie wanted to add anything to what Emily had said. This is the marijuana legalization study.
I think Emily did a pretty good job of covering what we discussed, but yeah, just to kind of reiterate what she said, the COVID pandemic has obviously caused a lot of stress in people's lives. So, and we know that marijuana in some instances is good at alleviating that stress. And then again, to tie back to the original question of any racial implications, we all know that people of color are disproportionately and adversely impacted by lots of legislation currently and criminalization of marijuana and other drugs. So we kind of just wanted to see if we could find any way to help in that sense.
I agree. I believe that Emily Bennett basically covered everything that I would have previously said.
Okay, thank you so much. Welcome, Brian Alva. Hi, can you say where you're hailing from?
Hi, yes, I'm from William Patterson. I'm a second-year student. I'm worked on the project with Christopher Watkins and Kashani Pereira.
Okay, welcome. Did you want to add anything to that? We're talking about how these projects impact the current pandemics that we're dealing with, whether it's the racial reckoning that's happening across the US or COVID-19.
I would definitely think that, especially with all the data that's coming out and how COVID-19 is affecting minorities in this country, we're going to start seeing a lot more, I think, anxiety and depression when it comes to just minorities in general. And I do wonder how, with our study, which was racial microaggressions, how that has been exacerbated in the medical system, and how how it has actually impacted people of color when they go to seek different medical treatment, especially during this time. So I'm curious to see how that's gonna look like, you know, within a year or 2 years, and how it's really truly impacted the mental health of minorities during this time.
Yeah. I want to throw in a question that has nothing to do with anything that we're talking about, but maybe it does have everything to do with it, which is that the elections is about a week or two away. And I'm just wondering, how do you, as students, what are your thoughts about what's going to happen and how you're going to work with your clients around some of the anxieties that are, you know, that you've talked about? And there are two sets of anxieties at minimum. And it's just sort of, you're thinking about that, because this idea that college students have increasingly higher incidences of psychological distress is a national phenomena. It's not just in New Jersey. And so I'm just wondering, you know, as we're talking about, you know, microaggression, substance use, looking for connection in relationships and dating, and all the, you know, needs of different populations, like, what are your thoughts about November 3rd. Is second or third? November 3rd, yes.
Oh, I think there's, sorry, go ahead.
It's okay. All right. I think it's kind of just the same takeaways or the same things I would do otherwise, but just more of an emphasis on it. A reminder of my poster was just like mindfulness and acceptance relative to social media use. So, I mean, like in terms of relating to the media and the information that comes in, viewing it just as that, as information, and building skills to disengage and disentangle if any entanglement happens with the information that comes out, if it's distressing with people and the political outcomes. So I think it would just be the same stuff. I think mindfulness is really important, and acceptance and self-compassion, which are some of the themes in the other posters too. So emphasis on those ideas and practicing them.
Okay, thank you. Brad?
Thanks, Brad.
Yeah, no problem. I was just gonna, I'll actually piggyback off of what he said in terms of mindfulness. A lot of what I'm noticing with my clients now is a mixture of anxiety, some depression, and it does have to do with the political climate, and it also has to do with the pandemic and the racial issues that we have going on today. But I think one of the big things I put an emphasis on is balancing your life out, and that's especially with college students, as you had mentioned. On a national scale, there's a lot of pressure with school and athletics and responsibilities at home and family dynamics, let alone the other issues that we're dealing with. So I think balance comes very vital in this situation, and mindfulness is a key to that.
Thank you. Dominique, did you want to say something?
Yeah, I'll lower my hand here. Yeah, I'd like to echo other sentiments about mindfulness. And kind of our acceptance and commitment therapy approach that we use at Kane University, really focusing on values and committed actions toward those values. And my other comment would be is some of the research, at least for graduate students, psychology students, all graduate students have maybe more distress, but they also have high levels of resilience. So really trying to recall those strengths that we have, remember those in those times of difficulty like now.
It's a very good point about resilience. Thank you for that.
Yeah, if I could just jump in really quickly with our findings, I think it's a great question, and I think this is where we can consider what I hear from a lot of patients that I see as feelings of like helplessness during this time, right? Helplessness around the pandemic and also around the racial issues that are being brought to light. And so I think that's when, we come in importance as, future psychologists or those who are psychologists already, and being able to work with individuals on a clinical level, preparing for those that may experience distress around the election or around some of these other issues, and just, preparing ourselves and all this great research that we've looked at today around these issues, being able to consider these findings and apply them in our clinical work is really one of the most effective things I think that we can do, is not allowing this research or the other research that we do to kind of get dusty on shelves, but to really apply it to the people that we're working with. So I'm excited to do that.
Yeah, thank you so much. We do have time for a few more comments. So maybe Dr. Torres, would you like to say anything to the group?
I just think they did, oh, sorry, my video's on. I think they did such a great job. And I think, some of the interesting things that we found too were how some extra struggles that multiracial people were experiencing, multi-ethnic folks were experiencing. And I think sometimes we follow our manualized treatments and forget to ask about these things that are kind of in our face, this COVID pandemic, this racial kind of reckoning that's been happening lately. And I do think that it's important to just get a vibe from your clients, because a lot of my clients are talking about these things and the distress related to it. I know it's hard to disentangle our own feelings about it with what the clients are saying, But I do think that aside from, doing your treatments as usual, also kind of keep in mind all the things we're talking about and how important it is to assess where people are. Because I do think microaggressions get ignored. So I do think that it's helpful to make sure that we're checking in.
Thank you so much for that. And congratulations on your award as well.
Thank you. Thank you.
So I think that's all for now, unless someone else had something to contribute. I just want to thank you again for doing such good work. I really love this format because we will be making this recording available, as well as all of your presentations are on the NJPA website, which is lovely because in the past we haven't been able to disseminate the work that's been done in the poster session. So while it's unfortunate that we can't be together, the good that has come out of this is that more people are viewing your work and having access to it. I just want to encourage you and thank you for the good work that you're doing. Please keep it up. And I look forward to welcoming you to the Academy when you're done. So have a good day and enjoy the rest of your semester. Thank you so much for joining.
Thank you.
Thank you.
Thank you.
Thank you.